and pressured speakers, respected director, principal, vice principal, invited delegates from various regions, my dear colleagues and students. Coming together is a beginning. Keeping together is a progress. Working together is success. And we, the management, faculty, and students of Lourde College of Nursing, are thrilled with zeal today as we have the honor and pleasure of hosting another webinar in a series of 5 sessions. We look forward to opportunities for collaboration, spurring the development of ideas, theories, and practice in the history of nursing education. Today is the first day of our state-level webinar series, Growth and Development, a Progressive Advancement of Little Lives. And we are fortunate enough to have 5 very eminent and excellent healthcare professionals as our resource persons for this series. And I am delighted to announce Day 1, Lieutenant Colonel Nirmala Roberts, Principal, Santhi College of Nursing, Kozhikode. Day 2, Professor Dr. Nandini M., Vice Principal, Ashwini College of Nursing, Thrissur. Day 3, Professor Radhi M., Almas College of Nursing.
Dr. Nirmal, please unmute mute your mic, please. Dr. Nirmal, mute your mic, please. Yeah.
Day 4, Professor Usha V., HOD, Child Health Nursing, College of Nursing, Medical College, Anjarakandi. And day 5, Professor Dr. Soorya Joseph, Principal, Little Flower College of Nursing, Angamali, Ernakulam. Why are the early years so important to children's later development? Why should we pay more attention to and understand the growth and development of our little ones? The early years play a key role in children's brain development. Babies begin to learn about the world around them from very early age, including the prenatal, perinatal, and postnatal period. Children's early experiences, the bonds they form with their parents, and their first learning experiences deeply affect their future physical, cognitive, emotional, and social development. Optimizing the early years of children's lives is the best investment we can make as a society in ensuring their future success. Dear participants, we have 5-day sessions continuously and the timing is 11:15 a.m. to 12:30 p.m. We expect your active participation on all days. And here we place before you a detailed description of all the stages of growth and development from infancy to adolescence from today. Welcome as a warm greeting sent your way to let you know that you are valued in a special way. I call upon Professor Senthilkumar.T Principal to accord the words of welcome. Sir, please.
Thank you, Nimmy. Good morning, one and all. Please mute your mic. Somebody in the background, please mute your mic. Please mute your mic in the background. Good morning, one and all. I'm really happy to see the gathering of nursing students, nurses, and faculty in Zoom and YouTube for joining state-level webinar series on growth and development, a progressive advancement of little lives, organized by Lourde College of Nursing. Please mute your mic in the background. Johnson, identify the person. Sorry for the interruption. Good morning, one and all. I'm really happy to see the gathering of nursing students, nurses, and faculty in Zoom and YouTube for joining state-level webinar series on growth and development, a progressive advancement of little lives, organized by Lourde College of Nursing, Taliparamba, Kannur, in association with SNA North Zone, Kerala. It's a fantastic, our brainchild idea of Department of Pediatric Nursing to align all KUHS BSc nursing students under one umbrella in the name of GNT. I'm sure that this is a mega webinar series under nursing fraternity during COVID-19 pandemic. Also, I am proud in hosting 14th edition of this webinar series after a successful completion of 1 international, 1 national, 4 state level and 6 college level webinar during this pandemic time. I take this opportunity to extend my sincere acknowledgement to my management, team of faculty, and the students of Lourde College of Nursing for these laudable ventures. Let me now specially congratulate Mr. Johnson LK, my Vice Principal, come Zonal SNA Advisor, and Mr. Sreeraj, Assistant Professor, Mrs. Soorya, Assistant Professor, Department of Pediatric Nursing, for their meticulous plan and execution of this mega webinar. Now, let me do my assignment of welcoming you all. First, I would like to place a record of welcoming to our guiding spirit of our institutions, Dr. KJ Devasya, Chairman, and Dr. Joseph Benavan, Managing Director, in their absence. To be inspired is a great, and to be an inspiration is an honor. With immense pleasure, I welcome our ray of sunshine, Mrs. Rakhi Joseph, Director, Lourde Education Academy. She is the real instrument for all our success stories. I welcome you, madam.
Thank you, Senthil. Thank you very much.
Yeah. It's my great privilege in welcoming Dr. Nirmal CP, a pediatrician at Lourde Hospital, who had been kind enough to accept our invitation for delivering an inaugural note for this webinar. I welcome you, sir.
Thank you.
I'm extremely happy to welcome the resource person of today's webinar, Lieutenant Colonel Nirmala Roberts. She has been pleasantly accepted to kickstart our webinar series with Infancy. Madam, you are most welcome.
Thank you.
Also, place a record of welcome note to the subsequent speakers, Professor Dr. Nandini M, Vice Principal, Ashwini College of Nursing, Thrissur, Professor Radhi M, Principal, Almas College of Nursing, Malappuram, Professor Usha V, College of Nursing, Kannur Medical College, Anjarakandi, Kannur, Professor Dr. Priya Joseph, Principal, Little Flower College of Nursing, Ernakulam. My heartiest welcome goes to my Vice Principal and team of faculty, students, and SNA Executive of Lourde College of Nursing, Kannur. It is my bounden duty to welcome all participant delegates from different corners of the world for this webinar series. Once again, my warm welcome to everyone. Thank you. Have a wonderful session.
Thank you, sir. A hearty welcome to you too.
Thank you, Nimmy.
We have a cheerful personality who walks shoulder to shoulder, hand in hand, and of course, a perfect solution to every problem with an abundance of creativity and intellect. Yes, our dear director, Mrs. Rakhi Joseph. Ma'am, I'm happy to invite you to deliver the presidential address.
Thank you very much, Nimmy. Thank you. It is indeed an honor. It is an honor to be part of every event organized by Lourde College of Nursing. Professor Senthil, I would like to first congratulate you for organizing this wonderful 5-day series. I would also like to welcome Professor Roberts. I'm sure all our delegates today are quite eager to hear from you. Our guest of honor today, our very own Dr. Nirmal, very much welcome to Lourde College of Nursing. Our College of Nursing has always been a ray of inspiration and a torchlight for all the rest of the institutions that we have within the campus at Lourde Education Academy. I do not really want to take a lot of time today because I think we are falling short of time and we are running a little late. To all my delegates, kindly apologize for the delay that has been caused because of technical glitches. We all know that Corona has taught us that we can get everything at a click of a button. And today we are presenting a wonderful topic on growth and development. All of us care and really, really look forward to a lot of information about all these 5 important stages of children in our life. To all my students and to all the students of all the other colleges who are listening today, I would like you to please kindly pay full attention because you are going to impart this knowledge to parents who will be listening to your words as words from Bible. Because any information that they hear about their children, any information they get to keep on how to take care, how to identify concerns, etc., on their children, they listen with a lot of attention. So when you give that information, you should be accurate in giving the information. So good luck to all of you. Professor Senthil, one more time, congratulations to you and your team. And I declare this event as open. And thank you very, very much for having me today. Thank you.
Thank you very
Thank
much.
you, ma'am. Thank you, ma'am. Thank you for your words of inspiration. It is indeed a tremendous privilege to invite Dr. Nirmal CP, Pediatrician, Lourde Hospital, for the inaugural address. He has accepted our invitation in spite of his busy schedule. Sir, please.
Thank you. First of all, I would like to thank the organizers who have given me a chance to address you in this auspicious occasion. So, straight away going to the topic, today's topic, that is growth and development. It's really important to me as a pediatrician because it's one of the most basic topics we pediatrician deals in our student time. But one thing that I would like to tell you is that there are what I personally believe is that
അതിന്റെ ലെഫ്റ്റ് സൈഡിലെ ഒരു ഓപ്ഷൻ
Excuse me, dear delegate, kindly mute your microphone.
okay, as my personal opinion, what I feel is like that all the health personnel should have a basic knowledge about the normal growth and development.
Dr. Nirmal, please unmute your mic, please. Dr. Nirmal, unmute your mic.
Hello, am I audible now?
Yeah, go ahead now. Go ahead now. Yeah.
Okay. So what I was talking is that what was I audible before itself, or was I not audible? I was
It's
not
fine.
sure
It's fine. You can continue now. Continue now. No problem.
Oh, okay, okay. So what I feel like that in my personal opinion, all the health workers should have a basic knowledge about the normal growth and development, not only a pediatrician. It's because of mainly three reasons. One is that because of this is a fascinating process that we can see before our eyes as a child grows. It might be your child or your brothers or sisters or your friends children, where you can see what you have already learned, like a computer algorithm which is going on, and it's a correctly process that you can observe what you have studied. So what it is one thing. Another thing is that it is the most common query that a health professional address from a relative. Like anybody will come into you and ask, my child is now 6 months, he has not rolled over. Is it okay? Shall we wait? Is there anything we can do? Or it's like that somebody may ask you that my child is 3 years old. He is only now speaking only one word. Is it okay? Shall we wait? We have to interview. This is a very common questions that we may, as a health professional, we may come across. Not only doctors, all health professionals may come across these questions from your relatives or your friends. So to answer that, you must have a basic knowledge about what is the normal process, what is the normal duration that we can wait. Okay. And the third thing of importance of knowing a normal growth and development pattern is that there is something called red flag signs. That is some certain milestone, if not achieved within a certain amount of time, you should interfere. Okay, we should identify this danger red flag signs in a patient before you or in any relative. This can be a life-changing event for that child. In all these developmental delays and all, etc., the early intervention is a key with which we can give a better life for the child. So, in order to identify this delay in development, first we should be aware of what is normal development. So, I believe that this program will enable all of you to understand normal development and growth deeply and make difference in children's who are coming to you in future. I wish all the best for you in the coming future. Thank you.
Thank you, sir. From the moment of birth, a baby is in the process of extraordinary growth and development. As they grow up, children develop many different capacities, and these capacities influence how they communicate, make decisions, exercise judgment, absorb and evaluate information, take responsibility, and show empathy and awareness of others. As nursing professionals, it is important to have a very good understanding of the process of growth and development. We have such a distinguished personality and child health specialist as our speaker today. With immense pleasure and delight, let me introduce our resource person for the first day of the series, Lieutenant Colonel Nirmala Roberts, who will speak on infancy. Colonel Nirmala Roberts is currently working as a principal of Santhi College of Nursing, Kozhikode. She completed her UG from Armed Force Medical College, Pune, and PG in Pediatric Nursing from SNDT University, Mumbai. She has an additional qualification of ICU course from Army Hospital, Delhi Cantonment. She's a versatile personality with vast experience in teaching and administration and has also presented and published many papers. She has rendered her service in Command Hospital, Pune and MH Bareilly, UP, and in many colleges and schools as professor and HOD. Madam is a life member of TNAI and NNF. She has also guided many research projects for UG and PG students and also was a member of curriculum committee for BSc Nursing under MUHS Nasik, Maharashtra. She had also been the editor-in-chief for Nitte Nursing Journal at Nitte Usha Institute of Nursing Sciences, Mangalore, and member of Board of Studies, Academic Council, Research Committee, and Editorial Committee at the Nitte University, Mangalore. She has been a part of workshops at national, state, and regional levels as organizer, resource person, and presenter of scientific papers. Madam is also an inspector of nursing colleges and schools under INC and KNMC. With great pride and honor, let me invite Lieutenant Colonel Nirmala Roberts to take up the session. Over to you, ma'am.
Good morning to one and all. I come from Santhi College of Nursing, Kozhikode, with greetings from my staff and all my students. Thank you very much for having me here for the webinar. I wish to thank the organizing committee. I do know Mrs. Rakhi Joseph personally, Professor Senthilkumar, and all his team have done a great job for this great venture. Let me also thank the audience, the students and the teachers for being present today. It's indeed a great honor for me. Let's take a walk into history, the history of our growth, our development. Yeah, it's very nice to think that, we all have walked the same path, though much has changed. So I'll now take my step. Here we go. I'll just share the screen. Sharing screen. Can you see the slide?
Not yet, madam. Yeah, it's coming up.
Can you see it now?
No, not yet, madam. Your co-host, you can share, please.
Okay. Now, is it visible?
Double click.
Where?
Yeah, fine, madam. It's coming up now.
Okay. Right. So today I'll be dealing with growth and development in infancy. Before I go to the nuance of infancy, I'd like to just go back. Dr. Nirmala has already spoken a little about importance of knowing growth and development in children. So we'll just see, just to revise what we have learned, what actually is growth and development. As you would see, it's a sum of varied, lot of changes that take place in our lifetime. It's very dynamic in that, it keeps changing for the better. And the various dimensions in the growth and development are interrelated. The physical, the physiological, the psychological, social, all these are interrelated, and each one affects the other. So as we go around learning this, we need to know how they affect each other. Growth is a physical maturation. So we say it is actually increase in size or weight of a whole. What we measure, in terms of maybe centimeters, kilograms, or grams. So it's quantitative. Development is also called functional maturation. It is qualitative because as the child grows, they learn, they develop a lot of capacities through growth and maturation and through learning. So we call it as a qualitative aspect of growth. The examples would be all the child learns to socialize, he learns a lot of things, he learns to move around. All these are part of development, which cannot be measured by a scale. Some amazing facts, what I'd just like to share is, the brain growth is so fast in childhood. It almost 80% is achieved by 3 years of age. Another 10% growth happens before child goes to kindergarten, say around 5 years of age. Visual acuity develops from birth to around 5 years. And there is dramatic improvement or growth in motor skills, socialization, learning, and personality. So when you receive a baby in your arms at birth, within a year, it is surprising to watch the child turning over, sitting, standing, walking. It is very, very amazing to watch. So I come to the next point. Knowing all these things, it's so important to learn this growth and development. Why should you study it? So like I was telling, and even before our speakers have been mentioning, when we study, what's the norms. Using it, we can assess a child and compare the findings against the norms and the red flags as has been mentioned. And thus we are able to see the strengths of the child and the potential problem child is exposed to because of any disturbance in the growth and development. We can also diagnose any issues that would be interfering with normal growth, like say malnutrition, infections, or some diseases. With all this knowledge, we can assist our parents, the parents of the children, to achieve optimum growth and development. This is not done just in the hospital setting. It could be anywhere in the community, in your home setup, your relatives, your friends, your neighbors. You could advise anybody on these things. In the hospital, we can plan for comprehensive care of a child with the knowledge of the normal growth and development in the child. And thus we can work effectively with children in both health and disease. So the child after birth goes through, of course, prenatally there is a phase in utero. After birth, child goes through infancy, early childhood, middle childhood, later childhood, and then of course they become adults. So I'll be dealing with infancy. Now infancy is a phase from birth to 12 months. The first 1 month or 28 days is dedicated for special care, and we call them neonates. This is a time that the child is adjusting to the external environment. The child has to learn to breathe by himself, eat by himself, maintain the body temperature. All these things are being done by self. So here they need time to adjust. So that time is a very important phase. And it is seen that in this early natal phase, the children are more exposed or more prone for increased morbidity, mortality. So they require special care. What do we expect in this particular age group of infancy? They adjust to the physical environment, physically and to the external environment. There is rapid growth, motor growth, cognitive and social. A child who doesn't know who's who is able to differentiate their own people and the others, the unknown. They're able to interact with the people around in the social environment. They develop trust in this age group, which is the foundation for establishing a social relationship with other people. In addition to all these things, the parents also have to undergo certain adjustments psychologically in order to deal with their infant. We shall see the child going through the growth and physical maturation, the motor skill development, psychological development, and of course, in the end, we'll discuss the needs and special concerns in infancy. So here we will see it in 2 parts again, the growth and physical maturation, the anthropometry or the proportionate changes in terms of body development, and the maturation of the various systems. The child's weight at birth is around 2.5 to 3.5 kg. In the first 7 days or 1 week, they tend to lose about 10% of the body weight, which is physiological. Why is it physiological? Because it is mainly because of water losses from the extracellular fluid by insensible losses, And of course, the kidneys are not fully mature, so it throws out a lot of water, a lot of urine. And besides all these things, the less intake of breast milk because the mother is yet attempting to produce more and more milk. So all this would contribute to initial loss of birth weight. And by the 10th day, the lost weight is regained provided the child is being fed adequately. Thereafter, the child gains about 20 to 30 grams per day in weight. And thus, by the 5th or the 6th month, the birth weight is doubled. After 6 months, by the 7th month onwards, the child gains about 10 to 15 grams weight per day. And by 1 year, the birth weight is trebled. So if you go back and see, at birth 2.5 kg, initial loss is 10%, so it loses around 250 grams. So child becomes 2.250 kg. And by 10th day, the child is back to 2.5 kg. And by the 5th or 6th month, the child doubles the weight, is about 5 kg. And by 1 year, the child is 7.5 kg. There's a formula to calculate this, the Vich's formula from 3 months to 12 months, which is x plus 9/2, where x is age in months. At birth, the child's length is around 50 centimeters plus or minus 2, which means around 48 to 52 centimeters. And the increase is like this, it's increase every month. In the first 6 months, increases around 2.5 centimeters per month. In the later 6 months, it is around 1.25 centimeters per month. There may be a little up and down of figures, but by the time the child is 1 year of age, he adds around half of the length to his length at birth. So a 50 centimeter child becomes 75 centimeters. The head circumference of the OSC. At birth, the child's occipito-frontal circumference is around 35 centimeters, which is more than its circumference by about 1.25 to 2.5 centimeters. The increase of OSC is around 2 centimeters per month in the first 3 months, so which adds up to 6 centimeters out here. And then the later 9 months, then increases 2 centimeters every 3 months, another 6 centimeter added. So at 1 year, the child's OFC would be 35 plus 12, around 47. So we say 45 to 47 centimeters at 1 year of age. The Dines formula is used for assessing the OFC of children in infants, that is length by 2 plus 9.5 in centimeters. And one more thing is this OFC is so important because it helps us to assess the child's neural development, brain growth, and look for any other neural abnormalities. Closure of cranial sutures. The infant has got broadly about 6 fontanelle, the anterior fontanelle, the posterior, the sphenoid, and mastoid. But the clinically significant ones are the anterior and the posterior fontanelle, and more importantly, the anterior fontanelle, which is used for assessing hydration and the status of the intracranial pressure. And this fontanelle closes by about 1.5 years, 1 to 1.5 years. The posterior fontanelle closes by about 1 to 1.5 months. The sphenoid fontanelle closes by around 6 months, and the mastoid between 6 months to 1 year. But we don't use this much in the clinical assessment. Now, by the first year of life, the child's brain weight increases by 2.5 times. So what's the brain weight at birth? At birth, the brain weight is around 10% of the birth weight. So it could be around 300 to 400 grams. It becomes 2.5 times, which means almost around 800 to 1000 grams. And mind you, the adult brain weight is around 1.3 to 1.4 kg. So we only wait to add another 400 grams after infancy. The chest circumference is 33 centimeters at birth. It is barrel shaped, which means the AP and the transverse diameter are almost the same. At 1 year of age, the child's chest circumference becomes around 45 to 47, which is equal to the OFC. And the transverse diameter exceeds the AP diameter, thus the chest becomes flattened, as you can see out here. The mid-upper arm circumference in the newborn is 9 to 11 centimeters. By 1 year, it increases to around 15 to 17 centimeters. Currently, it is not recommended for use among the infants because of much data not available on reliability. But after 1 year, it becomes very significant as an age-independent criteria up to 5 years. Thus, the body proportion of an infant, like this, a large head, it's almost 1/3 of the whole body, 1/3 to 1/4, say. A large trunk, short extremities. The midpoint of the body is at around 1.8 centimeters above the umbilicus. As the child grows, this would move down toward the symphysis pubis. Sitting height, the crown rump height is around 70% of total length, which again starts reducing and almost equals the rump to heel length. As far as dentition goes, the baby grows its first teeth at 6 months, but it can delay to as much as 12 months. As a rule, we tend to calculate the number of teeth as age in months minus 6, which is number of teeth, or we take the age of a child, we look at the teeth, and we add the number of the teeth to 6 months. But not a reliable parameter because, like I said, the teething can happen even later. But during teething, certain problems happen as the teeth cuts through the gums, with causing irritability, tenderness, and swollen gums. The child bites at a lot of things. Child bites the thumb and the fingers, but it hurts. So then he bites at his toys and other things. He may bite when he's breastfeeding, and this would carry on for some time. So then here comes the role of teethers. And the systems, how they mature. The cardiovascular system, the heart is transversely placed. One sec, I'll just connect the. The heart is transversely placed with the apex being at the 4th intercostal space. And we know in the adults, the apex beat is around it descends down to 5th intercostal space. The heart rate is 140 per minute at birth, 140 to 160. It comes down to around 80 to 120 by the time child is 1 year old. When the child sleeps, it is slightly lower by 10 to 20 beats. The blood pressure is about 64 by 40 in the beginning at birth, millimeter mercury, which increases gradually to 90 to 60. The systolic pressure actually increases in the 2nd month and then gradually increases further. Diastolic pressure falls in the initial 3 months and then gradually starts rising. Hematological system, the child is born with a lot of fetal hemoglobin, which was necessary for the child to survive in utero. It has got a special feature. It has got affinity, a good affinity for oxygen, and it's got though it has got a shorter lifespan. This lasts till about 5 months as it gradually phases out, and the HbA, adult hemoglobin, is taking its place. So the increased HbF suppresses production of erythropoietin by the kidneys, and added to this, following the birth and due to lack of supply from the maternal stores, the iron supply, the child could show anemia, physiological anemia, by the time the child is 5 months old. Now, this increased HbF destruction puts an increased load of bilirubin, and this is one of the reasons for the physiological jaundice in newborn and early infancy. The HbA increases steadily in the first 6 months, and then all is fine. Respiratory system, which rate is 35 to 50 per minute at birth, and it gradually reduces. 50 in the beginning, almost to 30, 35 by the time child is 1 year of age. Respiration is abdominal and diaphragmatic, mainly because intercostal muscles are weak and cannot actually work hard for the lungs to expand. They are mostly nose breathers till about 6 months of age. Important to know because we need to take care not to allow any cloth or any item to fall over the face when the child is sleeping. It could cause choking. Trachea is close to bronchi and the lumen are narrow, so risk for choking, aspiration, and respiratory obstruction. The IgA in the mucosal lining is deficient, though the mother's colostrum is rich in IgA. So if the baby is not feeding well enough, they are prone for contracting respiratory infection. They have a short eustachian tube which connects the nasopharynx to the middle ear. So when the child feeds and if there is milk getting into the ear, it could give rise to middle ear infection to these children. As far as GIT is concerned, the child begins salivation by about 3 months. You can see that this fellow drooling. The stomach capacity of the child is around 20 ml at birth, which it's around 7 ml per kg. And this capacity increases pretty fast. And by 1 year, it's around 360 ml. And the child will take feeds around 150 to 160 ml per kg in a day. Enzyme amylase, that's the ptyalin, is deficient initially, and because of which there is poor digestion of complex carbohydrates. But the maternal milk, the mother's breast milk, is best suited for the baby, and baby can digest it very well. It's only when they're given other feeds that they have problem with digestion. Liver is immature throughout infancy. There's another contributor for the physiological jaundice, in addition to what I told, HbF. The stools, there is an increased frequency of stools in the initial phases. In fact, neonate or initially first 2 months or so, they would pass too often. With every feed, the child would evacuate. What you call the gastrocolic reflex works out here. The breastfed infant stools are of more frequency. They are like golden color and they are more liquid in form with a faint odor. But those on the formula feed and other milk would have more solid forms of stools, which can give problem of constipation to them. By 1 year, the child is settled to have 3 meals in a day with 1 light bedtime feed, and they would have 1 or 2 bowel movements. The nervous system, we already had a discussion initially. So the brain weight is 10% of body weight and rapid brain growth is happening. Myelination begins after 3 months. That is when the child is able to hold his head, get control of the neck, and it continues further. And as it continues, the child learns to roll over and sit and stand and walk, and even understand or realize the innovation of the bowel bladder. So the child gets gradually ready for even toilet training. So it takes more than 1 year to complete, almost by 2 years. The primitive reflexes are replaced. Now the reflexes like sucking, rooting, tonic neck reflex, and all these are replaced by writing reflexes, and they make voluntary, purposeful movements after that. If it persists even beyond, say, 3 months, 4 months, some even up to 5 months, beyond 5-6 months, it is considered as a red flag to be taken seriously and look into any problems. Immunologic system, the IgG, IgM, A, D, and E are all being produced by the child in very small quantities. The maternal IgG is lasting up to around 3 months, and then babies are starting with cell synthesis. 40% achieved by, almost achieved at that time by 1 year. The IgM reaches adult levels by about 9 months, IgA by puberty, and IgA, as I told earlier, is produced in large amounts in the colostrum. They get it, and this protects the gastric mucosa. So it's so important for, here we tell the importance of breastfeeding. Baby is so well protected. And of course, the D and E Ig immunoglobulins take a little more time, and it goes into early childhood. In the meantime, as the baby is producing all these immunoglobulins, they're protected with timely vaccinations against the BPDs. Integumentary system, they're born with the good protection, the pneumonic gaseosa. The epidermis matures in the first month, and it prevents against infection, thermal losses, and water losses. The body surface area is about 2 to 3 times more by volume than that of the adult when you compare with the body mass. Like just to explain this, a baby who is about say 5 kg, that is say at 5 or 6 months of age, his body surface area is about 0.3 meters square, as compared to an adult who is say 50 kg And this adult's body surface area is around 1.5 meters square. So you can imagine the proportion. So here, again, another reason why the baby is at a greater risk of losing water and heat from the skin. Initially, there is absent shivering and sweating. So again, that body thermoregulation mechanism is not developed at that stage. With growth, of course, accumulation of adipose tissue happens, which helps insulation, and it improves. So after 6 to 7 months, the baby is able to regulate and create heat in the body. Fluid electrolytes, the newborn is 70% water, of which 40% is extracellular fluid volume, as compared to an adult who is around 50 to 60% total body water and 20% of ECF. So it's very obvious that a child or an infant who develops fever or has got diarrhea or any such condition where he loses water, they go very quickly into dehydration. The amount of water loss can cause dehydration because of the ECF. Renal system, it is structurally complete number of it is nephrons, there's a mistake there. It is nephrons. The number of nephrons is very correct. It is functionally immature at birth because it cannot actually concentrate the urine very well enough. So specific gravity is pretty low, 1 to 1.01. But there's rapid maturation happening in the first week, and the complete maturity is achieved by 1.5 to 2 years. Here again, because of the immaturity of the kidneys, there is a danger of dehydration and imbalance if they are not being fed adequately. The special senses regarding hearing, they have very good levels of acuity, as good as the adult. They can differentiate familiar voices, especially the mothers or the primary caregiver. And this they also show, expressed by making sounds when they hear familiar voices, mother's voice, they will cry or make small cooing sounds. By 7 months, the vestibular function begins. And with this, the child learns or is able to balance his body as he attempts to crawl and creep and gently starts to pull up to sit, stand and walk. This is where all this is achieved. They also learn to imitate sound that they've heard. They have a short external auditory meatus and nutrition canal, which puts them at risk of external ear infection and middle ear infections. By 12 months, they are actually been working hard at mastering a language. Though they don't speak well enough, they're ready to make a sentence or express themselves using 2 or 3 words meaningfully. The visual acuity is low initially. They're hypermetropic. You may be surprised, or many mothers have felt very upset, including me, when the baby looks beyond you, when you try to smile at the face. But that doesn't last very long. By about 1 to 1.5 months, when the binocularity is getting established, the baby is able to focus onto your face and give you a cute smile, what you call the social smile when you smile to them. By the 7th to 9th month, stereopsis is achieved, or it starts off. That is the depth perception. And it is fully mature later by 2 to 3 years of age. By 7 to 12 months, the vision is almost the same as adults. The smell and taste are well developed in these infants. They have preference to smells, to sweet smells. They can smell the mother's body odor, and the mother's breast milk smell is well known to them. And a baby who's been feeding from the mother for long, and for some reason the mother has gone away, and another lady comes to feed, they will refuse to feed from the mother because the smell is different. It is so strong. And by the later infancy, they start exploring the object through, they put everything in their mouth to taste and smell and appreciate their senses that are coming through. Touch is also well developed. Even when they have these, reflex movements, a touch is so important. And the touch gives them that social security and feeling. And they prefer soft, gentle touches and cuddles. We move on to the motor skill development. I put the pictures out here. Initially, in the early neonatal phase, you'll find they make a very general reflex involuntary movements, which gradually starts improving with myelination setting in. The child is able to balance the head by 3 months, and here the child is holding up his head. And by 4 months, the child can sit with support. You remove this item, this equipment, and the child can fall back. By the 5th month, the child can roll over from the supine to prone. After this, by about 6 months, if you make a child to sit, the child can sit without support, without falling away. By the 7th and 8th month, the child begins to crawl and creep. This is again showing the development of the vestibular function. It's improving more and more. The baby is able to carry his body, propel it forward. In fact, the gross motor development is all to do with the posture and locomotion. By the 9th month, the baby can stand with support. They hold on to tables, chairs, cabinets, and they can stand. By the 10th month, they even walk holding on to the chairs and tables. By the 11th month, the child is able to stand without holding anywhere, freely. And by the 1 year, they can take a few steps without any support. The fine motor development refers to use of smaller muscles for finer movements. Use of hands and fingers and prehension is what stands out here. Initially, the child has got the grasp reflex up to 3 months, and it disappears after that, and it goes into palmar grasp. So you offer any item into the child holds with the complete hand. You can see here, child holding the finger of the adult. By 8 to 9 months, they have the crude pincer grasp. You can see in this picture here, the child using thumb with the 3 fingers opposing to hold a bead. It's called the crude pincer. And then by 11 months, child will need pincer, which means the child is able to hold things using just the thumb and the finger opposing. And he can build a tower of 2 blocks, but cannot put more than that. They also are able to develop the eye coordination, hand-eye coordination, they can look and move things about, and hand-to-mouth coordination is also there. They can carry food items into their mouth. Of course, they might drop food, but they can take the food to their mouth. And they insist on feeding by themselves by 1 year. Coming to the psychological development, the psychosocial development here, initially it is a reflex behavior, and anybody can call the baby, they can carry and interact. By 1 month, they show the social smile. By 4 months, they can laugh aloud, and they play. They can hold anything, they squeeze things, and they enjoy. And this helps them socialize when the parents or somebody is there with them. Attachment is indiscriminate initially, but gradually they learn to discriminate their own and the others. They vocalize more to mothers, to their mother or the primary caregiver, and they show preferences for people and for things as they learned about the stuff around. By 6 months, they have learned about their own and others. They play games like peekaboo. You can see the child out here. He's got a towel, he covers his face, trying to hide, while the mother says, "Oh, where's the baby gone?" And the child would hide, and he feels that he is not visible to them. And then he'll ask to be carried. He'll put his hands up and say, "Carry me." He may not say carry me, but he just puts hands up in action of wanting to be carried. 2 important things that come up here after 6 months is stranger anxiety or stranger fear and separation anxiety. Stranger anxiety or stranger fear, I put a picture out here, where in the home, some unknown person has come, unknown to the baby, and the baby would quickly move to the parent and hold the parent, because this person is not known to them, which is perfectly normal. It's actually the right thing to know, because here we realize the child is learning the social connections. He understands the people in the society. He can recognize own people and those who are outside his circle. The CNS development also is important out here. Separation anxiety is where when the child is happy with the mother leaves the child and goes away out of the room, and the child feels the mother is gone for good, and he starts crying. He's not able to understand that mother would come back. So this is again quite natural. But with time, the child would understand this, what to say, that mother will come back, and later he will develop what you call uh, the long-term memory, where the memory is there that mother will come back, and this anxiety would reduce. What you call the object permanence. Eric Harrison has explained this developmental phase with the developmental task of trust versus mistrust. With the child who is taken good care of by the parents in terms of food, warmth, attending to all his needs, and keeping him comfortable, the child learns to trust the people around and is happy. And a child who is ignored or not taken care of well and abused learns to mistrust. And this phase is coming in two. In the early phase, there's the oral phase, where it's primary narcissism, where the child only wants self-gratification. So he should get food on time, he should get be given all comfort. When he feels cold, he should be wrapped up properly. When he wants to be hugged, they should hug. So it's all for primary gratification, his self-gratification. And later the child, when he sees people around, he learns to play and get feedback by making sounds and all that. He gets into social phase where he is able to understand that, yeah, there are more people around, and he interacts. And all this a happy experience would give more of trust development. Of course, we should not gratify all the needs, because then the child would not learn how to handle the lack of gratification too. So at times, so a little bit of mistrust and more of trust is what the child develops in this phase with a normal caring. Play and sleep. The play is sensory motor in this age, which means a child plays using his senses. He's able to handle things. He would visually appreciate the various colors, the sizes, the shapes. He would hold the toys, squeeze them, make noise, throw it, make it bounce, and he will hear the sounds. So through all this, and plus manipulations, motor manipulations. So that's how the child plays, and the child doesn't look to anybody else to play with him. It's more of solitary. It's narcissistic. It is basically for self-pleasure. So he enjoys doing all these things. At times I've heard mothers, they complain that this child is so bad. I give him the ball, he throws it. Again, I give, again he throws. Now, why is he doing it? Because the child is enjoying the sight of the ball bouncing along, or maybe the sound of the ball. So it is the pleasure of play, which the parents could be explained. It's dependent on the caretaker, because child cannot play alone. You have to support, like I said, giving the toy back or exchanging the toys or whatever. So child depends on you for play. During play, child laughs. That's also play for the child. You laugh, the child laughs back to you in an imitation form. Peekaboo is another thing. Pat a cake, he'll pat on his pillows, he'll pat on the bed sheets, he'll pat on books. He enjoys trying to flatten out things. It is repetitive, like he would like to keep throwing the ball. He'll shake the rattle repeatedly to enjoy the sound of the rattle making, and imitation of heard sounds. They're very selective after 6 to 8 months, because all this happens after 6 to 8 months. The child would only prefer known people and no strangers. But also play is very important to note that just allowing child to play is not important. You have to play with the child, because that is where the child learns socialization, and child also feels and develops a sense of trust through play. Sleep, as you can see, the sleep hours gradually reduce from the time baby is born, and towards by 1 year, it's almost just 12 hours a day. The cognitive development, explained by Jean Piaget. Sensory motor phase, which is extending up to the 2 years. And here the child uses learning through reflexes, deliberate acts, like we just now discussed. I've told manipulating things, and that's how. Repetitive acts later in the 4 to 8 months. The child expresses separation anxiety initially, but later settles for object permanence. Now here you can see this child, the mother was in the room, she left the room, and the child goes about crawling and tries to open the door to look where the mother is there. Or you hide a toy under a carpet, child will go and lift the carpet, because he knows now that the item is there. This is the object permanence what is developed. later in infancy. Stranger fear is normal here, but it should not exist beyond 2 years, because by then the child should learn to accept, understand people around. Then imitation is there and develops self-image by 1 year. So here's a child looking into the mirror, appreciating himself. You try to touch the various body parts in the mirror and make happy sounds. It would be good for a parent to sit with the child and show the parts, and the child also learns about the various body parts in this way. The language of child is generally cry initially for displeasure and pleasure. So the cry comes in various forms. It's surprising that mothers know the pattern of cry of the child. When the child cries, the mother would say, "Oh, my child is hungry." She will feed the child. When the child cries the next time, she will say, "I think he's wet his nappy." So there is a pattern of cry for everything, which a layperson won't follow, but that particular mother would know the meaning of the child's cry. And then they go through making various sounds, cooing, gurgling, imitating sounds as they grow. And later infancy, they understand the word no. When a mother says, "Don't do it," no. So they know there's something which should not be done. And the mother would be unhappy if I do it. And they obey simple commands, like "Come here, give me that ball, give me this item." And this is again used, for teaching the child. Like the mother would say, "Let us play with the red ball." So the child knows, okay, the red ball is that color, let's play the green ball. Or bring me that doll, that big doll. So the child learns various concepts. Because the parents use specific words while they play and through language. By 1 year, they can make 3 to 5 words with meaning, may not be grammatically correct, but yes, they can express their need. So they would say that if you call the baby as baby is a baby food, baby cat. So something, they would use 2 or 3 words to tell them what exactly they wish to have. Psychosexual was explained by Sigmund Freud. The baby is in the oral phase of development, and initially they are in the rooting and sucking reflex is there, which of course wanes out after 3 to 4 months of age. And oral stimulation is through gratifying activities. It's actually, at par with the Jan Piaget's development and Erik Erikson's. They gain trust and comfort through oral gratification, and you can see that the child is biting. Every time you find there's something in the mouth, and when they want something, they will either cry loudly, or they make sounds, happy sounds, or they chew at things. They may even they suck the thumb. So all this, the pleasure is around the oral cavity. And you will find some parents are very, very, particular. The child should not suck the thumb, should not put things in the mouth. And now with the COVID-19, it's all the more dangerous. So people get more worried, and they would try various means of stopping the child from putting things in the mouth, especially thumb. Thumb is a child's property. You cannot touch it. But yes, the parents are worried because thumb gets a bump later on after thumb sucking. So if the child is not happy in this particular phase with oral fixation, it's not just the sucking, it is the meeting of needs when the child demands. So when the child's demands are not met, they land up in a phase called oral fixation, which may present as dependency or aggression in a later phase, showing problems with drinking, eating, smoking, nail biting, and so on. So with all these phases of development, in all these theories of development, one thing is clear, that the children move from one phase to the next only after they have succeeded in mastering that particular phase. If they don't master or they don't overcome this particular phase, they get stuck out here, and they have difficulty dealing with the next phase as they grow. So to summarize, just to put the whole thing, this is what I have put here. They begin a social smile, they make some sounds, there's head holding by 3 months. By 4 months, they can grasp objects, which is a palmar grasp. They sit with support. 5 months, they roll over. Then they sit without support. Then they can crawl and creep. Then they develop this pincer grasp, thumb finger prehension. They can pull up to sit later, stand with support, walk with support, without support, and take a few steps. This is the timing given. But yes, we can always wait for 4 to 5 months delay to raise the red flag. But around this time is what generally the child would show these changes. Now we'll go on to the needs and special concerns in infancy. Human beings need love and security at any stage in life, and they require it maximum when they are infants. So you can see the parents dote on the child and give every possible, expression of love, express love. It is not just enough to say, I love my baby. Express the love. Teach the parents to express their love to baby by touching, by fondling, by kissing. All this, the baby feels, the warmth of love of the parents. Nutritionally, the child would require around 100 to 120 calories per kg in the first 6 months, and thereafter around 95 to 100 calories per kg. Protein requirements are around 1 to 1.5 grams per kg. Up to 6 months, they should be exclusively breastfed. I think we all know it's so important. Breast milk is so precious. So only breast milk feeding, nothing else, not even water, nothing. And thereafter, timely and quality weaning, along with breastfeeding, not just weaning. And weaning should be quality food, not just anything, to ensure that child gets the needed calories and proteins and other nutrients in the food. If it is not appropriate, there's problem of malnutrition and nutrition deficiencies in various forms. General hygiene is again very important for the child, because the child, maybe the child is lying in the crib, it's only the nappy issues that can happen, and regular sponging or bathing of the baby. But once baby starts moving, he crawls everywhere and anywhere. So very important to maintain proper hygiene. Promoting growth and development, like we just now saw, parents have got a major role, or the primary caregivers. And to add to it, the child can be brought to the baby clinic where they're assessed and guided on giving the best environment and best support for the growth and development. Promoting play, very important. Like I said, it's not just giving toys. It's very important that the child is played with. The parents or someone should play with the child, so the child feels that we feeling with somebody else. Sleep and activity. Sleep is another important factor for the child, because it is said that during sleep the child grows. The growth hormones are released, so the child grows during sleep. So child should sleep, and when awake should have good activity. Never leave the child alone when they are wanting to play. Infant shoes are good because generally they come with a lot of some squeaky sounds and all these things. So it motivates a child to walk. So when they're ready for walking, we give soft shoes which should not hurt them. And just for walking, do not leave them in shoes for the whole day. Care in teething. Yeah, when the child begins to teeth, the teething troubles happen. So you can give teethers to bite. It should be washed clean, and make sure once it falls, you must wash again. So keep extra additional teethers to give in the interim period. And of course, when the first teeth comes or second teeth has come, you have to start giving cleaning of the teeth. So initially you can clean the teeth with just a clean, wet cloth. But with more teeth coming, you have to get infant baby toothbrushes and gently brush, soft brushes. Gently brush, no toothpaste, just wet the toothbrush and gently brush. So child also gets used to brushing. And even these toothbrushes come with certain musical things, because I mean, if that is the way to make the child more interested in the action. Protection from accidents. Now the accidents can happen right from the child's birth, like I said, choking because of the linen moving, or the cloth child dress, or the bed linen, or anything moving over the child's face. They are nose breathers mostly, so prevent that. Then fall from the crib, and of course, because of oral face, they put things in their mouth. Anything goes into their mouth, so you must be careful when you leave them down to walk. The area should be clean. Put a clean rug, or the floor should be very clean, and anything in the vicinity should be clean, so that when it goes in child's mouth, it should not give any infections. When they start walking, by holding on to things, do not keep lightweight furniture around, because these things can fall and cause serious injury to children. So keep away all these chairs, tables that are lightweight. Should be only heavy things around, so child can hold on and walk around. Dressing tables should not have any cosmetics on that because it will become good food for the child and give rise to poisoning. So in short, a house where there is a small child doesn't look well set because all the decorated things are out of sight. It is only safe for the child to move around. Immunization and vitamin prophylaxis given timely, and this is how the child will be protected against infection and of course A deficiency. Protection from from infection, the infection of the skin, eye, ear, mouth infection, GIT, respiratory umbilical, all these we all know, we've been important. And now we are faced with protection against COVID-19 infection too. You can see a very nice infant with a cute baby mask, but please do not do this. Up to 2 years of age, babies should not be given face mask because as it is, their tracts are very narrow and they have difficulty. They're only nose breathers initially, and they have difficulty breathing. So they would have a lot of problems with it. And besides, they may start pulling and pulling at their thing because of the thing, and it will anyway become contaminated. So do not give face mask to children up to 2 years of age. A preferable one is a face shield, where the child is happy inside, they can see the whole world and nothing is interfering with their activities. Regular medical checkup is important. Like, so we have the Well Baby Clinic where you can catch problems and follow up done accordingly. Dental health we already discussed. By the way, this face shield is available in India now. Many hospitals are producing. I was reading up about this. And in Mumbai, Baijarbai Wadia Hospital has already made many face shields for starting with newborns. So the mothers, the moment baby is born, they put this face shield and they lift the face shield to feed the baby and then lower the face shield. So it is so nice. And the mothers wear the mask. Psychological needs all focus on developing trust in the child and of course to help child achieve easy socialization. So play with the child. Don't let child play alone. I keep stressing on this because today we have a family. Most families are nuclear families, and both the parents are working, and they will have a maid or someone or maybe some other person attending to the child who may not be, who would have to look after the other household chores, and they would leave some toys for the child and go to their work. It's a very sad thing for this child when they have to sit with the toys all by themselves. Take care to prevent separation anxiety. So initially the child would show this anxiety. So it's important that mothers should, parents should explain to the child, though they may not understand. When they go, the child would cry a lot. So you have to explain and go. When you come back, make up for the separation. You can tell them why they went out. The child may not feel yours. Prevent stranger fear and anxiety. Another thing what we notice in the homes is when there is a child, say 8 months, 9 months or 1 year child, when a stranger comes, we will tell, come on baby, say good morning to the uncle, shake hands with the uncle and go. Uncle will say, come baby, and then you plunk the baby into the uncle's lap and the baby starts howling. So do not ever do that. Give time for the child to get accustomed to the new person who has come there, and the new person and this child will be observing this new person. Gradually, the child will himself or herself accept this new person. So never push the child to do things in front of strangers. Encourage inquisitive behavior. As parents, do not be worried about this child may pull apart the toy parts and bang it and do a lot of things. It's partly inquisitive. They're little scientists. They want to examine what happens when they do it. Allow them to do it. Let the toys be destroyed, broken. But the thing is, take care they don't harm themselves in the bargain. Develop sensory perception. So censoring, various senses. Give them colorful toys. Give them toys of various sizes, shapes, mobile toys, textures. So they learn the colors, they learn the size, they learn and the squeeze toys making sound. So a lot of things. So through various manipulation, they are able to learn through their sensations about things. So when they are older and you tell them red, they would know what is red because they have handled red color. or they have handled blue color. So this is the thing. Avoid unpleasant taste. We know that in the hospitals also we have pediatric medications often come in a sugary base. You don't want to torture the children by pushing down, all bitter medicine down their throat. So as far as possible, avoid. You want them to have the best food or nutritious food, you immerse them in something that they like. Avoid painful experiences. Again, a child should not suffer pain for no reason at all. Therefore, even in the hospital, if a child has pain, report immediately to the concerned doctor and get instruction for pain relief medication. Never let child sit in pain and suffer and cry in pain. It is very, very inhuman. So with that, I've come to the end, and we have discussed today about, after the initial introduction to the growth and development, we saw the physical growth of the child, the physiological, the various systems, how they grow, we saw the psychological development, and of course, what are the common issues with infants and how to manage these problems. So now I'm open to any questions from the group.
Thank you, ma'am. How beautiful and affectionate it is to understand the stages of an infant's growth and development. Gaining an understanding of this series of developments will surely help us to provide better care and provide education to parents in various settings. And taking it personally, I could say I was traveling through all the past days where I enjoyed my baby's developing. And as you said, as you rightly said, the house where small babies are there will not be well set. My house is not yet well set because I have two small babies with me. And dear participants, it's time for question and answer session now, and you can clear your doubts if you have any. Please utilize the opportunity. And we are extremely grateful to you, ma'am, for the fantastic session.
Thank you.
It was really useful.
In fact, as I was presenting, I was walking the lane with my child. You know, it is a heavenly experience to have a baby in your home. And I think we should carry forward these kind of tender feelings and a caring attitude when we care for any child in the hospital, especially as, I must say, pediatric nurses or as students in the hospital. When you come across any children, we have to find, understand their level of development and be able to care for them. Questions?
Dear participants, you can clear your queries if any. And also, please note the participants that the feedback link is posted in the chat box. You can fill the feedback and the certificates will be issued. I could not find any queries in the chat box. If any participants have any queries, you can either talk directly or it can be posted in the chat box. Participants, please see that it is a time for you to talk, to ask questions.
Are there no questions?
In fact, nobody has posted any questions and
okay.
Nobody is coming up also with questions.
All right.
Thank you, madam. Thank you very much for your wonderful session. Like we are not getting any questions from the participants. But I apologize for that. There is some technical issue come up while we are trying to make through go for YouTube live. But still, the recording is going on. But anyway, after this session, your session again will be available in the YouTube. Those who are missed the session can able to watch again in the by logging to Lourde Education Academy YouTube channel. Sorry for this inconvenience caused, and I'll encourage all the participants that again to be login either through Zoom meeting or to YouTube live tomorrow also and day after tomorrow for next consecutive 4 days of session, please. And thank you, madam. And then Nimmy, you please proceed further. Thank you.
Thank you so much. Thank you.
A grateful heart is a magnet for miracles, and thankfulness is the quickest path to joy. I invite Mrs. Soorya Joy, Assistant Professor, to propose a vote of thanks. Soorya.
Good afternoon to all. I deem it a great honor and privilege to propose the vote of thanks on this auspicious occasion. First of all, thank by giving glory to the Almighty for making today's resounding success. I take this opportunity to thank Dr. K.J. Devasya, the chairman of Lourde Education Academy. Dear Doctor, I render my sincere words of gratitude in your absentia. Now, I would like to thank Managing Director, Lourde Education Academy, Dr. Joseph Benavan, who is the backbone and pillar of Lourde Education Academy. Thank you, sir, for your timely support and guidance which you are giving to each one of us. Thank you, sir, in your absentia. I express my sincere gratitude to Mrs. Rakhi Joseph, Director, Lourde Education Academy, who is the backbone of our college and who is always with us with your timely support and encouragement. Thank you, ma'am. Thank you so much. Now, I would like to thank Dr. Nirmal, Pediatrician of Lourde Hospital. Thank you, sir, for your very presence for this webinar, and thank you for delivering a motivational and inspirational inaugural address. Thank you, sir. Now, I would like to thank Lieutenant Colonel Nirmala Roberts, our resource person, Principal, Santhi College of Nursing. I appreciate and congratulate for your wonderful session about growth and development in infancy. We are thankful for your time and effort made towards making it a memorable one. Your lecture was impressive and would certainly benefited all of us from the breadth of knowledge and depth of expertise. Thank you, madam, for your valuable lecture, which helped us to improve our knowledge about the topic. Thank you, madam. Now, I would like to thank our principal, Professor Senthilkumar.T, who is the source of inspiration and motivation for us to conduct this webinar, which is very useful and helpful for all those who attended this session. Thank you, sir, for your timely support, care, and concern for each one of us to make this day a successful one. Now, I thank our Vice Principal and Advisor of SNA North Zone, Mr. Johnson LK, for his dedication, commitment, and parallel support to make this webinar a successful one. Thank you, sir. My heartfelt thanks to our HOD, Mr. Sreeraj RN, and heads of various departments and the faculty for their valuable contribution, guidance, and encouragement in all our efforts. Now, I would like to thank all the students and all those who participated in this webinar. It is an audience like you that make presentation very awesome. Thank you very much for your unwavering attention throughout this webinar. Once again, thank you one and all. Thank you.
Thank you, Soorya. I hope all of you had a nurturing experience. It was really a wonderful one. And we expect the same zeal and enthusiasm in the coming sessions of our webinar series too. Thanks and regards from Lourde College of Nursing. Once again, thank you all.